Hi, I'm Dr. Ramsay Farah from Farah Dermatology and Cosmetics, and I thought I'd share with you a little bit of information about COVID-19 and skin manifestations. So today was the first day that Dr. Joyce and I got consulted on a potential COVID patient at the upstate hospital, and they had a skin rash. And so I thought I'd share a little bit of information about the skin manifestations of COVID. And I think that would be helpful because I think you'll find it interesting. And also, the more we know about this condition, I think the less we're afraid of it and the better we can deal with it and hopefully move on to a brighter day in the future. So the information we have about skin rashes and COVID comes from the experience of dermatologists in Italy. So with the all hands on deck approach that the Italians had to have because they were so overwhelmed, many of the dermatologists were actually asked to go into the hospitals and care for some of the sicker patients. And they noticed a couple of things. So first of all, they noticed that about 20% of patients who have COVID-19 will have a type of skin rash. Those skin rashes are comprised of three types of characteristics. The first is urticaria, and the layman's term for urticaria is hives, and I'm sure you all know what hives look like. They're kind of these red, non-scaly blotches that come and go rather quickly. So urticaria is one thing that you can get if you have COVID-19. The second thing you can get are petechiae. And petechiae occur when a little bit of blood leaks out of the capillaries of the skin. So they look also like little red points on your skin, almost as if you took a pepper shaker and shook it onto your skin. That's what petechiae would look like. And they're non-blanchable, which means if you press on them, they will not go away. And the third thing that can occur with COVID-19 patients is something called a livido reticularis pattern. So livido means like a fish net or net-like pattern of redness. It literally looks like a red fishing net imprinted on your skin. And the reason why that happens, usually it's because of a vascular spasm or blood vessels going into spasm in the skin. Now I should say that these conditions, petechiae, urticaria, and livido, are not really specific for COVID in the sense that other things can give these to you. But it seems in patients with COVID, those are the types of things that seem to come about. Now, I said 20% of people get a skin rash. Of those 20%, 40% of those individuals will get these skin rashes at the beginning of their symptoms, and the rest will get it later on during the course of their disease. I should also note that the symptoms are not just the red lesions I talked about. There can be some itching, but it's usually mild. And another piece of interesting information is that the onset of these skin rashes does not correlate with the severity of the illness should someone have it. So I think, I hope this was useful for you. Like I said, these are not specific for COVID, but it's another piece of the puzzle that we can use. And that's what doctors use all the time. They take bits of information, they fit it together like a puzzle, and they come up with the most likely diagnosis. And so the skin has some diagnostic utility in what's going on. So I hope you find this interesting. Don't forget to wear your mask, and please stay safe until the next time we see each other.